On March 27th, ABC for Health filed a complaint with the IRS over Dane County Hospital's Community Health Needs Assessment. They took issue with the report and the process these hospitals use, saying they excluded important community voices and ignored the community's medical debt crisis. They fell short of federal requirements and seemed to put their own hospital revenue over the needs of the community. The IRS does require nonprofit hospitals to conduct a community health needs assessment every 3 years and then implement strategies to address the needs that they hear. But it all starts with taking stock of the voices of the community. And they've got to hear from various sources, including members of medically underserved, low-income, and minority populations, as well as patients at risk of not getting adequate medical care because they're uninsured or underinsured. And ABC for Health's complaint says they fell short of those federal standards, basically because they did not listen to the voice of those underserved community members. They failed to discuss access to coverage issues, including hospital financial assistance programs, and they failed to address the impact of medical debt on Dane County patients and seemed to intentionally ignore input, including input from ABC for Health. The complaint said UW Health failed to adhere to the requirements of the IRS, stemming from a value to put revenue over community and portraying many principles and requirements of nonprofit hospitals. They said this is at odds with UW Health's duty toward the community. Now, the IRS regulates this space, like we said, because these are nonprofit hospitals, and to be tax exempt includes a responsibility to give back. A hospital's approach to medical debt is a direct measure of how they give back, and hospitals have a community benefit they need to provide. Part of that benefit is making sure that they're providing enough charity care and services to the vulnerable members of their community. In a statement, ABC for Health's Director Bobby Peterson said Dane County hospitals must do more to justify extensive tax breaks and better serve patients impacted by health disparities. In fact, he said in 2023, Dane County hospitals spent on average only 0.7% of their gross patient revenues on charity care, and he reminds us that the national average is 2.3%. And he said by filing this complaint, they're making a little bit of good trouble. We wanted our voice and the voice of our clients to be heard. You can read that complaint. We link to it in the description below.